Good evening. My name is Dr. Mark McComey, and I'll be speaking with you tonight about new technology that solves the main issue with the single bond adhesives. Um, I'm coming to you from Chattanooga, Tennessee, and I'm in private practice. I'm a wet finger dentist, and my partner is my wife in my practice here in Chattanooga, Tennessee. I went to the University of Utah, and I went to the University of Louisville School of Dentistry. I've been in private practice for about 19 years now, and before, when I was in college at the University of Utah, I was a lab technician, and that's how I paid my way through college. And so I've seen many different facets of dentistry, and I'm also a clinician's report evaluator. I've been one since 2006, and I've evaluated over 400 products in my office. And CR Foundation is a very interesting organization. They don't take any money from manufacturers, and they only um, get the money from doctors and dentists and hygienists like those dental professionals that are on tonight. Tonight we have people from Lebanon, California, Qatar, Netherlands, Portugal, Ontario, Wyoming, Ireland, Australia, India, Turkey. It's an honor to be presenting to you tonight, and I hope we're presenting some things that can be of value to you in your daily life as a dentist. And currently with track research from CR, I'm doing a bioactive clinical restorative study with Relic Christensen, and I'll talk about that at the end of the show tonight and show you some of the things we're doing there. So anyway, CR Foundation, I really love this organization. It does a lot for dentistry, and it really supports dentistry in many ways. They have 40 on-site scientists, 400 clinicians like myself around the country, and in 16 countries worldwide, and do 20,000 field evaluations a year. This is my family. This is my practice in the upper right. That's where I am sitting right now, speaking to you, and that's my wife, who's the other dentist in this practice, and there's our daughter. Picture on the left is in our backyard in Chattanooga, Tennessee. It's beautiful here. If you ever get the chance to visit, stop in. Tonight we're going to have these topics to discuss the keys to bonding, direct bonding, to be successful in that, and discuss the main issues with single bond adhesives. And starting in the mid-1990s, single bond adhesives, commonly called the seventh generation, started coming in, and they were introduced, and there were some problems with them early on in some of the other companies, and we'll review some of these adhesives and the new single bottle universal adhesive that's recently being marketed. And there's a new amide monomer that solves the issue with these single bottle adhesives, the seventh generation adhesive. This amide monomer has never been seen before, and I'm excited to talk to you about tonight. This amide monomer is amazing, and it couples together with the classic MDP monomer, and the two of them, the MDP chemically bonds to the tooth, and the amide penetrates the tooth easily. And this is going, I'll show you what it allows, but it allows really quick and great chemistry to form and give you a very high bond, similar to the sixth generation adhesives that have become the gold standard, but in a quick time. And so then we're going to review some changes with the new adhesives since 2010, the universal adhesives they're called. And then I'll give you a summary of what the new universal adhesive is, what's going on there, and then we'll summarize and we'll update what we're doing at CR Foundation with Gordon Christensen and Relic Christensen, talk about that bioactive studies and some of the bulk fill composites that are out on the market. So the keys to successful direct bonding, one of the main things is you've got to create a dry field, and you need to be able to see what you're doing and keep the tongue out of the way. We introduced this into our office several years ago, and when we first did it, our assistants thought we were trying to replace them, and they kind of didn't like it. And at the first day, and I said, it's not taking anybody's job, it's supposed to make your job easier, and that it did, and it's increased our dentistry, the amount we can do quadrant dentistry. And so this is what it looks like. There's these let me turn on my cursor here, and this goes on the end of your HVE, and there's these little channels over here. It does all this, and it's a great system, and it really helps you do better dentistry, a higher quality dentistry, and it'll make it quicker. And so I'd encourage you to you don't have to get ISOLite or ISODry. They provide this light that lights up the room, so to speak, and really provides a great working environment. It helps you do better dentistry. Rubber dams are great, but a lot of people don't like using them. The other thing is curing lights matter. And at CR, they did an evaluation on these $7 curing lights you can find all over on the internet. They're usually made in China, and they're cheap, and they make some pretty good claims. But so they put them into the study, and they got a good to fair rating, believe it or not, for $7. But other lights that got a good to fair rating, you can see there, are $900 and $1,600. So just because you spend a lot of money on a light doesn't mean it's a quality light. They're in the current Clinicians Report newsletter, Gordon goes in and talks about lights again, and the importance of a light. It's impossible to underrate it. And so these $7 lights, while they got a good to fair rating, I don't recommend you use a $7 light, of course. They have a good high intensity, but the small diameter tip, you would have to move that all over a tooth to get that thing to cure correctly. And so we recommend, Gordon Christensen's group, we found that you need a good quality light, a proven light. And this is one of the proven lights. It's the Velo, and now there's also a Velo Grand, which has a larger tip that goes down on the tooth and provides a good cure. And there's also the Dent light, and it's a little bit cheaper. It's about $1,000. And so these lights are proven. One of the things that you need to do with your light is get that thing perpendicular to the surface. Many of the lights, like the one down here on the left, you've got this tip that's angled at this angle. So to get that flat on the surface like this one is, you would have to have the patient open like this. A lot of patients can't do that, and nobody wants to do that. So you can come in here and you can see the jaws a lot not open, cranked open as far. What we end up doing with this, right, is we swing the light down, and then that moves the tip so we're not coming in at that correct angle. And so let's make sure we have good lights. It's super important to the bond. You really can't get a good bond without a good light. And so I'll let you read that for a second. But check out the CR Buyer's Guide for good lights. The Blue Face from Ivoclar is a great light. The cheap $7 light, there's no support. It was really kind of a flimsy piece of junk. Let's move on. This is Chattanooga, Tennessee. This is my backyard, and that's the Tennessee River out there. Just down from our house, there's a dam called Lake Chickamauga. This is Lake Chickamauga. The Chickamauga Dam holds it back, and it's beautiful here. I hope someday everybody can get to come to this part of the world. So anyway, let's get into what we were talking about before. What's the problem with those single bottle adhesives? Water is the problem, and you'll see in this lecture the background is water, and that's I can't say enough how important it is to be able to handle the water and to keep the water out. And water can break down your bonds over time. And the original MDP adhesive monomer, now I'm going to say the original MDP adhesive monomer is insoluble. There's a lot of companies making MDP now, and MDP was originally patented by a company called Carrare, and that patent has expired, and there's other companies able to make it now. I'm going to show you some differences today about the MDP monomers and things, but a lot of these 7th generation bottles, the universal adhesives, are switching over to the MDP monomer because it's the best monomer. And so water can still be absorbed in those single bottle adhesives that are HEMA based. And HEMA is a hydrophilic monomer that penetrates dent and enamel and is used in a lot of adhesives. And I love this. Bonding has everything to do with the stability of the chemistry. So we need to make sure we're choosing wisely what we're doing, and which our adhesives really do matter. Now, back in the early 2000s, this is from the Journal of the Canadian Dental Association. In 2003, they're saying, are the dent adhesives too hydrophilic? And what they're seeing, this is that, what's it called, the Prompto Pop. And it was getting these bubbles that you see down here. And so some adhesives absorb a ton of moisture, even 30 minutes after they're sealed. And so what they do is they cut the tooth and then they put silver nitrate on it. And the silver nitrate is taken up by the water. And so it shows all this water in here in these black areas, and that's the water that was in there in the bond. And look at these bubbles. The dentinal fuel fluid comes out in there, and the single bottle total etch adhesives used in the in vivo to seal crown preparations. And so you can see that there's a water problem in a lot of these. And so the long-term clinical studies on class 5 cervical lesions, this is your retention rate, and this is the 5th generation single bottle total etch adhesives that were in the 90s. And so you can see the retention rate was 69% and 59%. I certainly hope we've improved on that with things we're doing now, and mainly the materials. We need that. We need the correct stuff in there to make these bonds work correctly. So this is the 13-year class 5 cervical lesions in dentin only, and this is clinical research, dentin only retention rates. And so this is that original MDP we're talking about. And so the first bonding system to include flowable resin up here on the left, made by Clearfill by Carrare. And then you can see the dentin only retention rates were 74%. That's the mild acidity, citric acid, total etch, and MDP monomer. So, and I'll let you read that, the dentin only retention rates there. And so what's happening under your bond? And that's what we really want to know about, and that's important. What is going on underneath that bond? We put them in there, we pack a bunch of composite on top of it, and then we don't really know as clinicians what's going on. So I'm going to share some science with you, and we'll get into some clinical slides as well. This is a picture of a transmission electron microscope, and I'm going to show you some. These are TEM, or transmission electron microscope images. And so here's where we, again, the black down here, this is representing where water is being, the silver nitrate's absorbed by the water when the tooth is sectioned. And so we look at these and we say, okay, we've got bonding agent out here, dentin here, and dentinal tubules, and this is the water down here at the base of the bond. Optibond solo, all this water. And then we have this over here, and this is really somewhat of a paradigm shift. We've got the original MDP and this new amide monomer. This new amide monomer, and look, we barely have any water being absorbed, and this is a single bottle. It comes in a single bottle with the MDP and amide monomer, and that it's doing a great job and really giving us something that we haven't seen before. And there we are again, this showing the new chemistry with the original MDP and amide monomer. And so when you come over here, we're looking at less water absorption with the amide monomer, and this is the self-etch technique. And remember, in the self-etch techniques, we have the smear layer, right? And smear layer is basically the sawdust of dentistry. And so in this dentinal tubule, there's a smear layer plug that's left in there, and that keeps us from getting the sensitivity. I remember when the original SE bond came out, and all of a sudden the sensitivity, we were doing full etch before that, sensitivity dropped, and it went away virtually. And it, you know, everybody said, oh, those white fillings, they're sensitive, you don't want one of those. Well, it's these dentinal plugs that are staying in here with the smear layer that's keeping that. And so then you come over here, and very little water with this new amide chemistry. So we have the MDP monomer and the amide chemistry, and it's giving this these great bonds. And the advantages of this new technology right here, MDP is originally patented by Carrare in 1981, and it creates an insoluble chemical bond with dentin, is not broken down by dentinal fluid or water, and the amide is very hydrophilic, less water absorption, penetrates the dentin enamel quickly and easily. It shortens application time to as low as 3 seconds. You know, right now the quick ones, you know, we have the universals that some of them are down to 10 seconds. Most of them, you've got in the 6th generation, you've got the 2-bottle system that's a 10-second, a 20-second, or a 20 and 20. And this is a single bottle at 3 seconds that's working as well as what we were seeing in the 6th generation. And this is what it is. This is the name of the new, it's called Clearfill Universal Quick Bond. This is the new MDP amide technology, and it's available only in this one bonding system. And so it's the thing about it is it's so universal. It's all etching techniques, all restorative procedures, maybe used quickly and easily with self-adhesive resin cements, fluoride releasing. It releases fluoride when you put it in there. Chemically bonds to zirconia, which a lot of people claim you can't do. This does it. Chemically bonds with lithium disilicate and glass. That's our Emax, right? And then becomes a dual cure when used with an activator. And so it does all these great things. It's truly a universal, and this new amide monomer. So here's one we did. This is a random Monday morning in my office, and we did this with this abfraction lesion right here on this tooth. It's more ditched out than it looks there. The color's not real terrible, but we want to get on that before it becomes a complete huge knot. So I did this is a full etch here, complete etch. And then this is it. When it's done, that's Majesty ES2 Classic, and then Clearfill Universal Quick Bond was the bonding agent. This is another case on a, I know if you're a wet finger dentist like me, you see these all the time. We've got these going constantly. We see these big failing amalgams, and so I came in, we took it out, and then what we have right here, I want to talk about this matrix system because I love the matrix systems have really changed a lot over the years, and this is that 3DXR ring from Garrison, and that's a composite 3D fusion band. And then with a larger composite restoration, I like stiffer composite because it matches the tooth structure. It has the same modulus of elasticity as the tooth. It's really close to it, almost exact in number. And so it's going to hold up in these big situations where we've got this whole cusp tip out here. We've got a huge occlusal buckle here, and this is an MOB. It's really big. And this APX from Clearfill, from Carrare, really will fit the bill. I want to show you what I like about that APX. And I think this video really demonstrates what is going on with APX. When you put APX in the tooth like this, it goes down in, it has a buttery smoothness to it. And it reduces, bring it in the horizontal, pack it in there, and look at that, the way that packs in. It's really smooth. It's just goes down in, fills all those voids, doesn't leave a bunch of stuff. Some of these materials that were being sold today, man, they're not smooth, they're not buttery like that, where they just flow down in there and smoothly pack in. And that's the real Matrix by Garrison there. They're a pretty neat matrix band if you haven't seen them. I encourage you to go to Garrison's site and look at their matrix bands. It really complements the Carrare things as well. And the way that APX packs in there and it cures up real nice, it's a really good, good composite. Composite layering techniques. In order, in dental school, we were taught this oblique. And so what we've learned is horizontal is the best one. It gives us the most strength, and in the video it said that out to the side there. And you can see the effects of the composite layering on bond strengths. This was done in 2003, and this study, all these studies, I've listed the references down here at the bottom, so you can look them up, or you can contact me if you like, and we can send them over to you. But going from a bulk fill, you got 11.8 on the bond strength. Oblique, where we're coming in all over the place. Vertical, now I don't even know how to do vertical. That'd be pretty hard. I guess you smash it against the walls, and it'd be hard to get that last layer in because you'd have to go horizontal on the last layer, I guess. But from vertical to horizontal, look, you get a 77% gain when you do 4 layers at 1 millimeter each. 77% gain by just packing those layers in there horizontally, as opposed to going oblique and all kinds of different angles. Try to get those things straight up and down. It really does help. So back to the case that we were doing there clinically, and then this is a selective etch technique, and the K-etch and gel, that's out around here. And you can see the frosted enamel, that K-etch and gel left us there. And now this is kind of, we need to orient you here. Where you're looking in a mirror here down at the teeth over on this side. There's not 2 brushes in there. But we're bringing the Clearfill Universal Bond Quick in. 3 seconds. That's all we need, is just 3 seconds in there. That's basically enough time to rub that around in the tooth and then grab your air syringe and dry it. So by the time you get that in there around the tooth and you reach over to get your air water syringe, that's about the amount of time that needs. The new amide chemistry relies less on air drying and it's way more forgiving. This material is very forgiving. One of the things that drives me crazy is when you have a material that works great in the laboratory and then they bring it to your office and it's like, it's so complicated, it's a full chemistry set, and we're sitting there with a live patient that may or may not want to be there. They may salivate really terribly. They may want to swallow every 2 seconds. They may try to stick their tongue on it all the time. Incidentally, this is the isolite over here with these holes, and you can see the fluid being suctioned up in between those things. I love isolite. You need to use some way to keep that back. Rubber dam is the gold standard. A lot of patients don't like it, I understand. So that's kind of where I like this isolite. It works really well in our office. So we dry that off for 5 seconds. Then we hit it with our light. This is a Velo light from Ultradent, and I use it on high power. That's 3 seconds, and a regular light would do 10 seconds. And then Clearfill Majesty Flow. I always do this. It's a highly filled flowable, so it's got a good wear about it. But right here, I'm just putting it down in the bottom of the preparations, and then I'm bringing in the APX. And this slide I wanted to show right in here. I put a little, I cure that first layer that's only a 0.5 millimeter thick, and then I put more flowable down in here. Then I put my APX on it, and as I pack the APX in, the flowable squishes up around it. And I do this to keep from getting voids all over the place. And then this last one I wanted to show is there's that wedge. I love these wedges from Garrison there. These little rubberized composite type matrix right here, and this is the ultra adaptive wedge. It gets in there, the little rubber things kind of do a fishhook effect, and sometimes when you put in these sectional matrices and you push down on that composite, it'll squirt that wedge right out the side, and a lot of times you don't even see it, and then you get an overhang. So these wedges are pretty neat. There's the cured resins in the tooth, and they're ready to be finished. I'm not going to go into finishing today because this lecture I really want to talk about bonding. So water, water, water. Water is the main issue. Remember, the main issue is water. So how does this new MDP amide chemistry, I keep saying the gold standard 6th generation, how does this 7th generation one stack up against the 6th generation adhesives? And so this was done by the Tokyo Medical and Dental University, and this is Denton bond strengths. And so you have these different ones. This is the Clearfill S3 Bond Plus with the orange top. The S3 bond that originally came out was purple and had a top like this. Universal Bond Quick, which is this new one with the amide MDP monomers in it. And this is the gold standard, right? The Clearfill SE bond we've had since, oh man, probably 99. We're pushing, what, 18 years with it. It's a fantastic, it's the gold standard across the thing. We're in with Gordon Christensen, there are 400 dentists in the room, and he ask who's using the Clearfill SE bond, and probably about 50 to 60% of the people in the room raised their hand. And the reason this works, we use it, he said, why do we use it? And everybody said, well, it works. The reason it works is because it has this MDP monomer. The new one has that and the amide. And look at the difference in bond strengths, only 2, but we've got 3 seconds invested in the new one, not 20. This is Tokyo Medical and Dental University data, and this is water absorption by volume. And the Clearfill S3 Bond Plus, you can see, took in a lot more water than the previous 6th generation. Well, now we look at this 7th generation one, the Clearfill Universal Bond Quick, and we're right there. We're actually better than the 6th generation. So this is the first 7th generation that's actually able to beat the 7th generation. And so how do the bonds last in chemical use? And this is a microtensile study. What they did was they took a mold, they put the bonding agent in it, then this flexible mold, they pop it out and they put it in this machine and they break it. And so that's the first column over here. And then the second column, they put it in water in a beaker for 24 hours, and then they put it in here and broke it. And so that's tensile strength, pulling it apart. And so here you can see the Clearfill S3 bond. You know, it did pretty darn good, but look at the new one. This new one is just, man, the bond strengths are just very close to the 6th generation that's the gold standard. Such an excellent thing. Then look, after 24 hours, they go down, and then when you go out and you soak them in water for a month, look what happens to the old 7th generation without the amide monomer. Now look at the new amide monomer in there. It's virtually statistically about the same as the Clearfill, the gold standard. Now, leaving it in a beaker full of water isn't really a practical thing, because we really don't put our bonds in beakers of water. You know, they're down underneath fillings, most of it, possibly the edge of it sticking up. It's not the whole bond sticking in there. So this is a little bit of a trumped up test, but these are passing it in flying colors with this new MDP. So the Clearfill S3 Bond Plus, remember, the DEJ of a tooth, the dental enamel junction, is at 51. And so these are coming in here really strong. After 24 hours, we're really close. We're getting up into that where we're almost as strong as the DEJ. The difference with the new amide monomer. Now, you have the high flexural strengths, and then this is HEMA. HEMA is used in a lot of bonding agents out there, and I'm not going to name the commercial ones, but you can look them up if you like. We'll have them later on the show. But you have this HEMA. Look, at it just flops over like a piece of wet spaghetti after it's been in the water. The curamide monomer, look at that. It's still straight. It's still strong after it's been soaked in the water. And so what's in your bond? So like I said, Scotch Bond Universal, all bond, here it is. They have the HEMA that we showed in the previous slide that was bent. The new amide monomer is in the Clearfill Universal Bond Quick. Clearfill Universal Bond Quick is going to lead the category in my opinion. It's a very, very good, the new amide is amazing. So this is something I learned from Tagami from University of Tokyo when I was down in Florida with him one time in Orlando. And he showed this a few years back, and I wanted to share it with you today because I found it one of the most amazing things in dentistry. There's something, he's calling it, he noticed on observation in scanning electron microscope, there's this acid-base resistance zone. And so you have the resin, and then you have this zone here, and then dentin. And where they're putting this in here, where the bonding agent was going with the MDP monomers, they were seeing this zone that was resistant. So this right here represents dentin dissolved by acid, but look at what happened to the acid-base resistance zone. It did nothing. And so he named it, he entitled it superdentin, because he didn't really know what to cause. And it's fluorapatite dentin created by a mild acidic and fluoride releasing bonding agent is what that is. And so in the previous one, without the amide, you see this little bit of erosion here when you get to the superdentin. So superdentin's always been one of those things that's been fascinating to me, because once you put down the MDP and the amide monomers, you get that superdentin that it doesn't dissolve in acid. And so there's, you know, I keep waiting for the commercial application where we can put this on root surfaces and make them impenetrable to decay and to erosion. It's a neat technology, and really when we're looking at something down in a base, if we can get that superdentin in a cavity that's really deep and it's resistant to the acid, and it makes it a better thing. I can't imagine a more biomimetic or bioactive type of thing we could do for our patients for a tooth. I want it done to my teeth, I know that. And so this is the first single bondable adhesive with the physical properties of a 6th generation gold standard bonding agent. And so Bart Van Meerbeek did this study, and he's come into a lot of studies. This over here has probably been the most tested bonding agent in the world. Not probably, it is. 283 tests since 1998. And so it's the most tested bonding agent there is, and it's become the gold standard. Every time I see a bonding study, Clearfill SE bond is always the comparison. And so I want to show you something that we do every day. This is, again, a random Monday. It was actually this last Monday at my office. And so we have a post space down there to put a post in. And so what if you could cement your post with a material that would also be the core? Would that help you out? because a lot of times you put these cements down in there and you got to wait all this time. So what we're doing is I'm going to show you what I do. And so we have the Clearfill Universal Bond Quick with the mini micro brush, and I've been using Clearfill Universal Bond Quick as my primary bonding agent for a few months now. And so we put it down in there. We air dry it first, and then you can get pooling down in the bottom where you can't get that air. And so it's recommended you take a paper point and you put it down in there, and it will absorb the bonding agent, pull it up out of there so you don't get that puddling, because there's nothing worse than putting a post in there and you look real good and then you take an X-ray of it and you have this gap between your fill and the post, and you think, what the world happened? Well, more than likely that's bonding agent down in there. It's blocking it up. You really did get the post as far as you could, but you cured the bonding agent in there. So getting it out of there, light cure it. And then this is the DC Core Plus, and this is the endo tip. Put that endo tip all the way to the base of that and fill it. Bring it up quite a ways. And this is what the product looks like, and this is the syringe it comes in. You just push that down in there. And then you treat your glass post with catching gel. And then you've got a choice here. You can either use the ceramic primer as your silanating agent. It doesn't have catalysts in it, and so it won't make the dual cure material go faster dual cure. Or you can use the Clearfill Bond Quick. And so both can be used as a universal restoration primer bond on the post. Either one of those will work great for you. I kind of like having one bottle in the room because it's, less things to mess up. And the Clearfill Universal Bond Quick chemically bonds directly to the zirconia and glass-based ceramics. However, it contains catalysts that will quicken the set times of your dual cure materials. And so you bring it down in there. You can use it with either of these materials. It'll make them go a little quicker. With the Clearfill DC Core Plus, Clearfill Universal Bond Quick should be light cured first to avoid quick setting of the core material. So that's why we light cure down in that post beforehand, is we don't want it curing the DC Core Plus even quicker than DC Core Plus. That's a dual cure material, light cures and it auto cures. And so it's ideal for putting a post in, and then as you build it up, that's your core as well. It's not only the cement, but it's the core buildup. Such a neat material. You can make it dual cure with other manufacturers. When I'm saying it's dual cure, it'll make the DC Core Plus. I'm talking about Carrare products only. But if you want to use this with another, like over here we have a Relax Unisem and Luxacor over here, you put a drop of the DC activator with a drop of the Clearfill Universal Bond Quick, mix them together, and then put them into the prep, and it will make your another company's stuff dual cure as well. So then here we go. We put the glass post down in there, push it down in. There it is. And then we light cure it, and we're ready to prep that tooth for a crown if that's what we're doing. It's a great material. I encourage you to look for it, DC Core Plus. This is another just Monday morning this week, and here we have a carious lesion. Looks small on the surface, and I advanced 2 slides. And then here it is excavated. We put a bevel around here. There is one over here. The way I shot the picture, the light didn't bounce off it the way I wanted. And this is the Blue View Vari-Strip by Garrison. It's a great matrix band. It has a curvature to it that wraps around the tooth. It's not just a straight piece of mylar. Those can sometimes be a little tough, and the Blue View Vari-Strip really will hug to that tooth and conform to it, especially if you're doing something bigger than this. This is relatively an average size, maybe small size there. That's a pretty small tooth. So then there we are with our Universal Bond Quick. Light cure it, 10 seconds with a regular power light. Injecting flowable into it. I like putting a little bit of flowable under every composite. And then there we are with our Majesty ES2. Pulling the band over the tooth. I like to wrap it. That creates it stops the oxygen inhibit layer and really makes it shiny and nice. And then we bring our light in and we can cure right through it. And there it is. I like to light cure through a mylar strip to get no oxygen inhibited layer, and it gives you a nice glossy surface on that composite, and it really aids you in being able to finish it quickly. So there's been, I really like this, there's been tons and tons and tons of changes in bonding agents since 2010. And there's been many single bottle adhesives that have been introduced, and the majority of them, this is interesting, the majority of them have switched to an MDP adhesive monomer. So why did they all want to use MDP adhesive monomer instead of what they were using before the patent ran out on MDP, right? So what is MDP and how does it work? And why are they all switching over to it? And this is a picture of the MDP molecule. And the D stands for di, which means 10. And this hydrophobic group, we have 10 of these. And they studied this, and this 10 is very important. Not 6, not 5, not 12, but 10 gives you the best bond. And so up here you have your polymerizable group, and then you have your hydrophilic group down here. And so let me explain a little bit more about this. So the features of MDP, it chemically bonds to dentin, enamel, metals, and zirconia. It creates an insoluble chemical bond to dentin. It's not affected by the dentinal fluid, which is really important. The MDP has the 10 CH2 chains, like we talked about, the spacer they call it. It has a high affinity absorption to hydroxyapatite and very low solubility in water, as we've shown before in the previous slides. So examples of an insoluble chemical bond of the original MDP. So what this is this is nano layering, and this is a TEM again, and the image represents MDP and calcium chemically bonding and layering. The layers are calcium, MDP, MDP, calcium. This is very unique chemically bonding dentin, very durable. And so you see lots of these little, what we're looking at here is the stuff that looks like a fingerprint kind of. These little lines that are running all over, and they're running in various directions, and that's our nano layering. That's what we want to see. And so when we come here, here's a couple other products. And so they have MDP, but not the original MDP. And so they get, you can see some nano layering over in here and here. Here's the one we showed just before with the Clearfill S3 bond with the MDP, the original MDP. And then you see the nano layering over here with Scotch Bond Universal. And this is according to Bart van Meerbeek. He did this study, not me. And his study really shows the difference in the nano layering. And the nano layering is so important. Purity of your MDP matters. And as I stated before, not all MDPs are the same. And so while the main patent on MDP has run out, MDP, they still own 2 patents that keep their MDP different than everybody else's. And so they have a unique way the MDP is manufactured and purified. And then they also hold a patent on the unique catalyst that cures MDP very well when compared to others. And so you've got the 2 patents that are keeping their MDP unique. And so this is bond durability of phosphate monomers with different molecular structure and purity. And so you can see the different, these are our monomers down here. These are the different companies. And so the original Carrare MDP, look at that. And so what this stands for, this TC means thermal cycles. So after 24 hours, the bond strength, and after 1,000 thermals, or 100,000, excuse me, 100,000 thermal cycles, the microtensile dentin bond test. These are dentin numbers, not enamel numbers. Everybody can bond to enamel. We want to know what the dentin. Dentin's the hard thing to bond to, and that's what we need to be able to do. And so you can see these, yeah, you have MDP down here, but it's not the same as the original MDP. MHP, which means 6 in that spacer chain. And I guess they use 6 because the D, the 10, the di was caught up in that patent. Again, this is Van Meerbeek's study. And so the challenge when using MDP provides exceptional chemical bonding However, it can be difficult to cure. And the MDP catalysts, the certain catalyst initiators in need for proper polymerization, and just because it has the MDP does not mean it has superior adhesion. The polymerization issue has to be solved. And then you need the purity level to gain those high levels. Again, you need a good light. This goes back to you need that good light to get that stuff done. And so let's look at the Denton bond strengths with Calibra. And this is dual cure resin using MPa, the millipascals and the MTP. Let's look at this. So we have the original MDP strengths here in the Clearfill SE bond 2, Clearfill bond, and Clearfill universal bond. And so you have the light cured and you have the self cure. So light cure and self cure, light cure, self cure, and then look over here, not original MDP, and look at the values where they drop off. Then you have the pentamonomer. I mean, this is just, that's terrible, 1.3. So you can see there is value in this with the original MDP. Again, here's the asterisk means they put the Clearfill DC activator in it, or the one from their company in it to get those bond strengths. The thing about this MDP monomer, along with when you couple it with that amide monomer, you know, Gordon Christensen at CR Foundation, he's always saying, is it better, faster, or does it save us money? Those are the things we want in products. We don't want to be better than the predecessor, we want it to be faster, or we want it to save us money. This does all three. This is marvelously priced, and you have virtually no wait time, so it makes you faster. It's as good as the 6th generation. It's very well priced again. But the thing with the no wait time, it's not that we want to be slamming through these and going quick. The wait time, having a less wait time, that helps us as wet fingered dentists because of why? Because we have to keep these fields dry. We've got a child in the chair. We've got somebody that swallows constantly. We've got somebody with a giant tongue that is hard to keep out of the way. They keep wanting to lick the thing. The shorter amount of time we're in there messing with that bond, the better our bond's going to be. So conclusions. All MDP is not the same. Universal Bond Quick is the 1st generation that is as good as the predecessor, the 6th generation gold standard. It is as good, faster, and it's well priced, so it meets all 3 of those criteria. You can't have a good bond without a good curing light. Self-etch, total etch, and selective etch. You can do all 3 with this new Universal Bond Quick. If you like total etch, you can total etch. If you like self-etch, you can self-etch. Use proper isolation. I can't stress that enough. That's something that really, really, really we need to do more of. We got to get that proper isolation there. This is me skiing. I'm originally from Salt Lake City, Utah. That's why I went to the University of Utah, one of the reasons. And that's me skiing at Snowbird a couple of years back. So what does the future of bonding hold? What's out there on the horizon? They've got things in the works as I'm reading different journals and things and seeing what's being studied. Bonding agents that need no waiting time, no curing. You're just going to put it down in the cavity and place your filling material and go. That'll be the next big step. But right now we've got a 3-second one. You have to cure it, but it's a 3-second one. I mean, it's pretty darn good. And then bonding agents that are easier to use, that are more accepting if they get wet, or you know, you can get it on there. You don't have to blow it certain thin. And, you know, back in the wet bond, when people talk about wet bond, it's always a big mystery when you're talking about glass ionomers. How wet is wet? I mean, how wet's that tooth supposed to be? With bonding, get the stuff dry and just do it. But in the future, they'll be more forgiving. Composite that is in between a flowable and a packable. So it kind of flows down in there. That APX is pretty darn good. And I'd like to see a little bit more flow out of it. And then self-adhesive composites, in other words, a composite that doesn't need any kind of a bonding agent, would be just amazing. And that's all coming down the thing. Let's talk about abfraction lesions and class 5 restorations. And let's you really need to choose a restorative system that has a proven long-term with clinical results. This right here, Bart van Meerbeek, I can't say enough good things about him. And this study is so comprehensive, and it is to me, it's the gold standard in, probably not just to me, probably to most people that love dentin bonding like I do, and dental materials. But in this study, they reviewed over 1,700 laboratory adhesive bond tests. There's 1,019 included in the analysis. They threw out the ones that were outliers, that were clearly manufacturer influenced, or their bonding was, they're using the same stuff and they're getting horrible bonds, not the same as what everybody else is getting in the studies. So they threw out those high and low, and they kept the center, so they kept 1,000 of them. Clearfill SE bond was the most tested adhesive in literature review of 280 studies. And then they reviewed 15 years of clinical class 5 studies. And then after they did that, about a year later, they came back and they updated the clinical review, and they analyzed 63 years of clinical studies. Unbelievable. And so that is so comprehensive. It's just unbelievable. Clinical effectiveness of the contemporary adhesives for the restoration of non-carious cervical lesions. And so what they found, these are percentages over here, and it goes all the way back to 1950, which, I mean, I don't even know what they were doing back then. I wasn't born. But they have the percentage of annual failures on these class 5s. So you get down here and you're looking at glass ionomer, 2% a year failure rate, 2-step self-etch mild acidity. Now, I talked about the mild acidity before. Mild acidity, the 2-step, what that is, that means SE bond. And 2% is all they were failing a year. And so you look at this and you say, okay, we have the selective etch, self-etch. At 3 years, Van Meerbeek showing 100% retention. 5 years. With the self-etch, you've got the 100%, selective etch, 98%. This is the one, big number here, 13 years out, still at 96% retention. And so this is the gold standard. Now we've got that. This is the original MDP, right? So the new one, the 7th generation, has the original MDP plus the amide. Long-term clinical research of Clearfill adhesive in abfraction lesions and class 5 restorations. 5 years, this is the Protect bond, right? Clearfill SE Protect, which is the same as this, except it has another ingredient that helps with sensitivity. This is the 7th generation right here. This is the oldie but goodie, the 5th generation. And you can see these numbers. I hope you can read them on your screens. It's one thing I can't see is you've got 92 and 96% over here, 100%, 97%, 97% retention. This is another one of those, I put this slide in there because this is what we see in our offices frequently. And so a little bit decay here. This really is erosion of some sort. Got decay there. And so with the Clearfill Bond Quick and then Majesty ES2 Classic, this is not finished with any rotary instruments, no polishing. This is just straight out after I got done with my hand instruments. And so when you get a material that can perform like that and give you those kind of results without even polishing it yet or doing anything, it really doesn't take that much time to polish it up and make it look really nice. And so that's one of the reasons why I choose Majesty, and I love how you can look at number 8 here and the way it's matching up pretty well, and we haven't even rehydrated yet. And so I told you we were doing this new study on bioactive restoratives, and this is track research by Dr. Rella Christensen. She's the one that's leading this. And so they decided we need to study this because they're making some really broad claims with this. And this is right off the Activa website. And Activa, which is a new glass ionomer that's coming out, they wouldn't really call it a glass ionomer. They want it to be in a new class, but it kind of fits in that class in the way we use it. And so they're making these things. The big one is releases and recharges calcium phosphate and fluoride, and chemically bonds, seals against bacterial micro leakage, no sensitivity, and moisture tolerant. So those are some pretty broad claims. We're doing a study. We're putting in these, we're using molars on class 2s, and each researcher is doing 2 restorations all these four materials. And so you have Herculite, which is our old Herculite. I forgot how much I hate the handling of Herculite till we did this study. Ketac, Equiforte, and Activa Restorative. And so they'll be followed every 3 to 5 years. And stay tuned, and I'll come back and do a webinar, and I'll tell you how these work out as we evaluate them once a year. These are some of them that are put in back here on this tooth. This right here is one of the glass ionomers. Pretty interesting color. This is one of the glass ionomers, and this is the other one. So it doesn't look as good as APX or Majesty or any other composite. It'll be interesting to see, because this one's done with APX. So anyway, that's about a 5 or 6 year old APX too. So bulk fill trend has its limitations as well. Dr. Christensen says that it's hard to ensure the complete polymerization of it. Again, a light is a big thing there. You know, you're putting in these huge amounts of composite down in there, and getting the contacts to be adequate when you're using a bulk fill in one big load. Everybody wants to go out the easy route and just put one big thing in there and hit it with a light and be done in seconds. I don't think we're quite there yet. We're developing a lot of white lines with that stuff. When I did some for a study and they were sensitive, and I pulled them out, and I found that I had a gap between the floor of the bond and the bonding agent, and they're pulling off the floor when I think they're pulling off the floor when I'm curing them. So this is my contact information. If you have any questions, you can feel free to contact me. There's my office's phone number, and we can go to questions. We got a couple minutes. Let me click on some and see what we got and see if I can answer them for you. The question is, what do I think about Sonic Fill Composite? Sonic Fill Composite, I really like the concept of it. The Sonic Fill, for if you don't know, it's a bulk fill composite, and it has a neat little way they have a little thing that vibrates as you put it down into the tooth, and it causes that composite to kind of flow down into the nooks and crannies a little bit. And Sonic Fill, I think it's a neat product. I think it's a great concept, but I think using the large bulk fill like that, you're getting a ton of shrinkage, and I think you're not going to be as pleased with it in the coming years as you recall it, as you will if you go back into one of the other things, one of these Carrare products. I think you're staying with APX is a good posterior one, and using those horizontal layers is that really increases the bond strength and helps your leakage a lot. And so I think it's a good thing. And so Sonic Fill, I think it's okay, but I don't think that it really is everything and all that they want you to think it is. Let me see. Let me pick another one here. Do you have thoughts on Clearfill Protect Bond? We've used it for years with great successes. Yes, Clearfill Protect Bond is that's what I use in my practice up until we've got this Clearfill Universal Quick. I'm seeing the same thing. If you like Clearfill Protect Bond, you're going to love Universal Quick. Clearfill Protect Bond, that is the gold standard. That's your 6th generation 2-bottle system. It just eliminates sensitivity. It's tremendous, and I love it, and I really, really love it. I think it's a fantastic. I think it's fantastic. So if you're using it and you find success in that, I don't really see any reason you have to change unless you want to change. And so the Universal Quick is fantastic, though. Let's see. Let's see. Let me get this one. Dr. Wynn, he says, to be clear, you used uncured flowable in the box form of all class 2s and placed packable composite and then cure. Yes, that's exactly what I do. I put, not a lot, I put a little bit of the flowable down in there, and then I put the composite up on top of that, and pack it in there really well. And what that does is, it's a rare day when the floor of your cavity prep, if you're just trying to get the decay out, that the floor and the walls and everything are just really straight and flowy and nice and smooth. It's really not that way. And so when you go to pack that packable composite in there, if you have a little bit of flow around that, it'll flow into all those nooks and crannies and keep you from getting those gaps underneath. When you have the gaps underneath, that's when you're getting the sensitivity and things. And so, yes, that's exactly what I do, Dr. Wynn. That's an interesting kind of off topic. I think this is Dr. Wynn. The last one is Dr. Fields, sorry. And it says, kind of off topic, what's your opinion on the composites that claim fluoride release like Shofu's Gyamers? Gyamer. Now there's something, they use this word Gyamer. I don't even know what Gyamer means. They're trying to say it's not a glass ionomer, I guess. They want their own class of filling material. I guess that's what they're saying. I go back to Rilla Christensen and her studies on the fluoride release, and she's showing the initial fluoride release comes off pretty high, but they're claiming that's what the study's about. They're claiming that every time you drink fluoridated water, or that you're going to use some, toothpaste, it's going to recharge it, and then you get this big giant burst of fluoride again that trickles out forever and ever. And that's part of what the study's about, is to see what we're getting there and see if that's really taking place or not. So all I can say for that is really stay tuned for that, and we'll get back to that. How do you know the self-etching is not over-etching? That's a great question. Great question, and I had a slide in there that shows that. So when you're self-etching and the MDP goes in there, and if you take your two arms and stretch them out and you pretend you're an MDP molecule, your right hand is out there like Pac-Man. It's munching. So it comes down on the tooth and it hits that tooth structure and it's munching away. As soon as that hits the calcium, it stops. It bonds. And so then the other end is ready to go bond with your restorative material, right? And so you could take the tooth and you could dump MDP. You could dump the the 7th generation bottle on it, the universal quick on it. You could dump it on there. It's never going to erode that tooth, because once it hits that calcium, it stops etching. That's how it knows, when to stop. People ask me that all the time. They say, now, is there some kind of timer in it or something? And that's how you know. It really goes in there and it does that. So that's the way that works, and I think it's great. And to be clear, to recharge, you have to have absorption, and absorption's not really good. So to recharge that glass ionomer, you would have to be absorbing water from the environment, right? And so what Rella is saying in her study, she says this glass ionomer thing is actually, they see it as a medicine. And she's saying it breaks down, and but it may have advantages, and so that's part of what the study is. And so if you have to have absorption to do it, you're absorbing that water, and as we've talked about this whole time, the water is the problem. And so Dr. Guzior, I hope I said your name right. What's the difference between glass ionomer and Activa? Well, Activa is it is a glass ionomer in ways. It has glass ionomer and it has resin. And the reason Activa is taken off, I think, is because of the handling of it. The handling of Activa is like a flowable composite. And if you've worked with a lot of glass ionomers, they are sticky. It's like a baby boogers or something. It just sticks to everything, your instruments, your hands. It's just all over the place, and it's really a tough material to handle. And so the Activa is trying to go back to it and make it better. Dr. Mathurin, I'm not sure how much for the MDP. Or if you're talking about price of the material, I don't know that in your area. You can contact Patterson or whoever your vendors are and find that out, or contact Carrare directly, I would recommend. And so Anyway, I appreciate it. I think it's an honor to be able to speak to you tonight, and I'll look forward to speaking to you again. And so thank you for your time, and I appreciate you coming here. You could be anywhere in the world, but you were here with me. Stay tuned. There'll be 5 questions and the continuing education. This is Mark McComey, and I appreciate you listening to my lecture tonight. Thank you very much.